Good afternoon, sir. We've come to discuss about the insurance-based health scheme that is prevalent in the southern states, specifically with regard to Tamil Nadu. Now that we know it's become quite popular, so why is it that so many critics are against it and saying that it's not feasible in the long run?
Yeah, if you ask me, the basic problem is that health system in India, inclusive of Tamil Nadu, is one of the most highly privatized health systems anywhere in the world. In fact, if you look at, say, the out-of-pocket expenses as a proportion of the total expenses on health, India is one of the highest out-of-pocket expenses. What is contributed by the public expenditure is one of the lowest in the world. Now, the basic problem with the type of insurance scheme that is being put in place in southern states as well as in the northern states anywhere in the country, it is basically done under the aegis of the that's basically the central government. That is basically the planning commission scheme. This is in some sense privatization of the healthcare system, even more of privatization of the already highly privatized healthcare system through backdoor. Instead of strengthening the public healthcare system, what is being done is that money is diverted into the private sector in the name of the health insurance. That is, many of these hospitals are registered under this system, and the funding for the treatment in fact goes from the public exchequer. Now, through this mechanism, the government can claim that it's in fact spending more on the healthcare system in the country, but at the same time, this money goes to the private sector.
Okay, sir. But, sir, as in with the current situation, do you think the public sector, public government hospitals are equipped enough to treat all the people in the country?
So, I think the answer to that is basically to strengthen the public system. In fact, ultimately, I think a good healthcare system is one where you have a nationalized healthcare system which is accessible to everybody. Like, for example, something like European countries, UK, and the best healthcare system in the world, by all accounts, is the Cuban healthcare system. Now, these healthcare systems are not very expensive. In fact, the Cuban healthcare system has something like, say, 1/20th of the expenditure of the American healthcare system. American healthcare system is the costliest in the world in terms of
private insurance.
Completely private, very largely private. It's not as private as the Indian healthcare system, the American one. It's less. Now, because government has systems like Medicare and Medicaid, which we don't have. But still, compared to say many of the European countries, certainly it is one of the most highly privatized systems. The United States. But United States system, for very many reasons, is one of the costliest systems, healthcare systems. And the Cuban healthcare system, which is complete public provision under the system, and it's universal. Everybody has the right to health, and their health indicators are better than the health indicators in the United States. So the type of healthcare system that you have in the United States is expensive and it's not even the most efficient. So what we need is something like that, rather than a system which is so highly privatized and is being increasingly more privatized. Now, within the southern states, in fact, the most successful system in this sense is Kerala. Even though the planning commission stipulation is that it is applicable only for the BPL. Here, additional that is one. They try to make it as much, universal as possible. And the universal system in healthcare is always better, even in cost terms. It is well known in health economics that in fact universal systems
is actually better
in cost terms. They cost less than the non-universal systems. Okay? And it so happened, in fact, some of the data that has come out from Kerala shows that people are going back to the public sector for treatment, particularly of the tertiary care treatment of late. Earlier there was a trend towards moving to private corporate. They're going back to it because of this, health insurance which is being done in a different way in Kerala. Let me put my, preferences. First, I think the best system would be a public provisioning of the healthcare system, which is universal, which is tax-based. The second best system is a system where you have an insurance which is provided by the state and which is provided to everybody.
Always, sir, would the state be able to take up that much expenditure, extending insurance?
Always, in fact, if you really look at the amount of expenditure required for any of this in a good system, it's very, very low, not that high. Very often, when they tell you that there is no money, it's not true. Okay? In fact, something like 3 to 4% of the GDP. If Cuba can do it at 1/5 of the expenses in the United States, why can't we do it? So that's my view on it.
Thank you, sir.
Okay, welcome.